Hey guys, my name is Micah Endres, and this is my NGO presentation about the NGO Child's Dream. So a little bit about Child's Dream. Its goal or vision is to provide unconditional help for underprivileged children in the Mekong subregion, and its mission is to empower communities to shape their own future. And the strategy they use is by working closely with communities to improve the healthcare and education for children. So I had an interview with Suchata Kanat, and her nickname is Mung. She is the head of a focus group of health, and they specialize these health programs within the Mekong subregion. 5 of the health programs are malaria control, immunization programs, vitamin A and deworming, village health worker and children medical fund, and then a school health program. So just so you guys can visualize a little bit better, there are 4 different regions, one in Cambodia, Thailand, Laos, and Myanmar that they all support. And Mung described to me that they use the bottom-up approach to allow them to evaluate, implement, and monitor their programs to address health and educational needs in the most efficient and effective way. And this just means that they look at what basic needs can be met in order to reach their goal of reducing childhood mortality. Primary health problems affecting the children within these communities are lack of basic health care, lack of general hygiene, lack of clean water and or waste disposal, lack of access to vaccinations and use of drugs or alcohol, HIV and AIDS infections, and then child labor. In fact, in Cambodia, there is about a 36% child labor rate, and a lot of these children are adversely affected by it and are not getting safe work education. So, what is preventing children from attending school? Mung said that one of the most important reasons why children and youth in Cambodia cannot complete their education is due to feeble health. And so that's why they like to implement basic health interventions to reduce the sickness of these children and allow them to participate in education and hopefully one day get out of poverty. So I asked then what are a few of the most prevalent diseases affecting these children, and she said that it was primarily diarrhea, acute respiratory infection, malaria, dengue fever, and malnutrition. And she sent me a couple of pictures, as you can see below. The one on the left shows the drinking water that the students have available to them, and they get that from the pond, as you can see in the middle. And it's the only water source in the village that she works at. And then on the right, it shows the very littered school environment that these children have to learn in. And then a couple of other questions I asked her were what health interventions does she feel is most important? And she felt that within her village health community, it was the village health worker program, immunization program, vitamin A and deworming programs. And she said it was because she works in such remote areas that the villagers don't have access to these basic health services and or health education. And then also, I asked if a significant amount of the children in that community were vaccinated, and she said that they actually have vaccinated about 10,000 children since 2008. And unfortunately, a lot of these children don't have access to the vaccinations because of a black zone in their country, which just means it's a zone of the country that is prone to a lot of conflict issues within the government. So they installed 4 solar panels within that community to support refrigerators to keep vaccinations cool. And she also went on to describe how they implement sex education in their education programs, and then also they have to be very careful about approaching community members with these things such as sexuality, menstruation, and respect for their different traditions, because these people do have traditions that are sensitive to certain topics. So to sum it up for you, feeble health is one of the biggest reasons for poverty in the Mekong subregion. Feeble health is due to a myriad of factors, including lack of clean water, lack of vaccinations, access to medications, and health, sex, and work education. And this just goes to show how these three primary factors of clean water and waste, education, and access to healthcare all contribute to good health. So that's my presentation. I hope that you guys enjoyed it. Thanks. Bye.